Hi, my name is Elizabeth McIntosh, and I'm going to be talking to you about third wave cognitive behavioral therapies and their implications today on nonverbal individuals. The use of language is a complex and higher order skill that can often be challenging to individuals with severe language deficits. Language looks a little funny because I've got it in Russian. I wanted to give you an idea of how an individual with autism interprets our language. And so the use of hieroglyphics to represent things that we're comfortable with is one way to explain that they have a little bit of a challenge. I'm going to start with applied behavior analysis. All three waves of behavior analysis follow some of the traditional techniques and then branch off. The traditional techniques that I use most often are establishing eye contact, following directions, MANS, matching to sample, discrete trial training, extinction, prompting, visual discrimination. And I have a definition from Hayes that states that the core of traditional behavior therapy was the assumption that the most important clinical task was to direct behavioral and emotional change created through the application of direct contingencies or associative behavioral principles. Next, the second wave of behavior therapy deals with cognitive behavioral therapy. And the focus is on changing individuals' thoughts and feelings. It's exposure, which optimizes learning and reduces fear and anxiety. The third wave of cognitive behavioral therapies deals with the applied behavior analysis and also cognition, which is a language-based therapy approach. The first one that I'm going to discuss is relational frame theory, and it has contextual features of situations, dialectical behavioral therapy, which is mindfulness, validation, and chain analysis, acceptance and commitment therapy, which is pronounced ACT, and it's on values and psychological flexibility. Relational frame theory deals with multiple exemplar training for generalization, if-then statements, and also uses prompts and reinforcement, and explains rules and stimulus equivalence. It's a language-based therapy. Dialectical behavioral therapy deals with emotional regulation, and it targets axis 1 and 2 disorders, some of which are autism, emotional dysfunction, depression, and anxiety. It uses extinction as a generalization technique and validation for therapeutic alliance with listening skills. Acceptance and commitment therapy, which is ACT, deals with thoughts and feelings. It says that they don't change behavior, but they're critical functional contextualism for predicting change. Psychological flexibility, which is the hexagon that encompasses acceptance, present moment awareness, values, committed action, self as context, and diffusion. They're all interchangeable. We deal with goals and values and the use of metaphors and analogies, which are a pragmatic language function. I have some pictures that I've included for my children that I work with that have autism. And these are nonverbal individuals and have a deficit in language and communication. Autism, as defined in Wright's Law, which was a proceeding from Stephen James versus the Newport News School System in Virginia, it's a severe disability, typically characteristic of difficulties with social interactions, difficulty with relationships, and significant impairments in speech and language and communication. Individuals with autism spectrum disorder can have severe deficits in either or both receptive and expressive language. They also have self-injurious behaviors often, and these are immediate behaviors that need to be dealt with. My ethical implications in this study were based on the ethical principles of psychologists and code of conduct, and I used maintaining competence and scientific professional judgment as my debate in the paper for using traditional behavior analysis versus potentially using Third wave cognitive behavioral strategies, which are all language based and higher order functioning skills, and a lot of them use pragmatic language, which is the area of deficit for individuals with autism that are typically nonverbal. C says psychologists planning to provide services teach or conduct research involving populations, areas, techniques, or technologies new to them, undertake relevant education, training, supervised experience, consultation, and study. And my ethical dilemma was learning how to incorporate language-based therapies with students that have severe impairments with language.